Hi, I'm Bruce Hellman, CEO and one of the co-founders of uMotif. We're a digital health company and we're building beautiful and simple mobile and web apps that help people track, monitor, manage and understand their health and share the data more effectively with clinicians to improve what's called shared decision making. The reality in e-health or m-health now is we think that there are two end users, is both the patient and the clinician. So we've designed the platform, the mobile and web apps, to really engage patients, so primarily from a patient point of view, but bringing that data back in a way that's actually really useful for clinicians as the other end user. In designing and building the app, we've engaged carefully and closely with patients and clinicians, so people like the Cure Parkinson's Trust and Parkinson's UK patient groups, and then with a number of clinicians. So in each of the 15 NHS centres that we're deploying to, we're working closely with clinicians to understand their wants and needs to make this technology really work from their perspective. In building the uMotif platform, we've thought a lot about patient use. So people use their phones 150 times per day. We've got to design an engaging and compelling experience to steal away one of those 150 for people to use that in health. So there's a strong design focus for patients. And of course we need to be thinking about how clinicians can then access and use this data. It is a bit of a tricky landscape. You know, there's no one-size-fits-all approach to clinical systems and IT systems here, there and everywhere. So we've built what we've been doing so that patients can bring the data to clinicians even without those links. And I think in the years to come, we'll see more and more links into clinical systems and being able to tap into hospital and primary care IT infrastructure. What's so exciting when we're working with the first 15 centres across the NHS is how the clinicians are really valuing putting patients in control. Because after all, self-management, people taking control is so important. So I think the clinicians are really engaged by people owning their own data, being able to track and manage their own health. And we're not hearing from clinicians any worries really that patients are more in control. In fact, they want this. There will of course be important considerations down the line about how that data is used in clinical appointments, plenty of medico-legal things to concentrate on and consider carefully. But that notion that people are owning their data, collecting it, tracking it for their own good is something that we think a lot of clinicians are really behind. I think what's so exciting about digital health is that collectively we're looking at the opportunity and not just focused on the short-term barriers. So there's a huge amount we can do, and let's not be waiting and let's not be stalling everything because of concerns and worries. Of course, we've got to think about the legal aspects, the data privacy aspects, making sure that patients are doing the right thing, and of course that digital health does no harm. But we shouldn't wait and just cogitate on these things without doing anything. So we think that the two things have to go hand in hand. As a fairly early stage digital health business, we think now is such an exciting time. More and more clinicians are driving for what we're building and creating. Patients are taking this sort of thing up, and the whole ecosystem is maturing and developing. So it's a great time to be an entrepreneur in this area. We've been fortunate enough to be able to access funding through the Small Business Research Initiative, which has really helped drive and fuel our growth, being able to do technology development, but critically the sort of evidence gathering you need in healthcare. So I think it's a great time to be an entrepreneur in this space. Of course, you can deliver a lot nowadays on relatively small cost with how computing costs are reducing all the time. And it's great to be in the UK as well. The work in the NHS gives us a lot of insight as well as credibility and a brand name that we can then go and take elsewhere. So we're really excited about the opportunities across Europe, US and other areas of the world. M-health, so that's mobile health. Using mobile phones or portable devices to be able to access, deliver and manage healthcare more effectively. So almost everybody's got a phone nowadays, whether that's a feature phone or increasingly a smartphone or a tablet. And I think that shift in amazingly high device penetration, even among the elderly sort of patient groups, other socio-demographic groups as well. Penetration is so high, internet connectivity in many areas across the world is improving as we go along. And the computing power we all have now in our pocket means that we can do incredible things that just 5 years ago would not have been conceivable. There are so many terms. We sometimes get a bit kind of confused. We say digital health perhaps as an umbrella term. You know, there's e-health, m-health, health IT, telehealth and telecare and telemedicine, all of this lot. I think it's using digital technology to create some new ways of delivering healthcare. And what we're excited about is when that digital technology actually is focused on fundamental human behaviours and human relationships. And that's where we see some exciting movements forward.